that there have been studies, and they're talking about the use of regular over-the-counter mouthwash being associated with the risk of hypertension, I think diabetes, high blood pressure. And that kind of concerned me, not because I'm necessarily a daily mouthwash user, but you know what I do use with some regularity is the mouthwash made by Biocidin for reducing the biofilms. So I wonder what your take is on this, and also on using the Biocidin, not mouthwash, actually, I use the toothpaste.
So great question. And actually I've made a video on this. It's probably been 6 weeks or so, but we've recently talked about this. So I'll point you to that one for a sexier presentation with
Sorry,
slides. No, you're good, with slides and things. But the way that this occurs is, as I know you're aware, you have an oral microbiome, right?
Yep.
And so for those who aren't aware, a microbiome is, most people are familiar with the gut microbiome, right? So we have a gut, and inside the gut, we have the bacteria. So probiotics, bad bugs, bacteria, virus, worms, yeast, parasites, all the microbes make up the gut microbiome. And that gets the most press in the health blogs and the research and everything. But more recently, there's been a lot more research on the oral microbiome. And the oral microbiome is the second largest microbiome in the body after the gut. The gut is the first largest. And so if we have what's a disturbance in the microbiome that leads to decreased probiotics and or too many pathogens, that can lead to all kinds of health issues that we've covered many times in many videos on this channel. So I'd have you just search, gut or dysbiosis, and you'll find lots of them. And so the more recent research on the oral microbiome is finding that decrease in oral probiotics can lead to health issues like heart disease and all the things that Linda mentioned, like hypertension and atherosclerosis risk and heart attacks and things like that. And then an increase in pathogens and oral pathogens also can lead to heart disease. And the classic case for this is one called Porphyromonas gingivalis. So we'll call it P. gingivalis for short, but science has known for decades that this is an oral pathogen that can jump in the bloodstream and attach to the heart and create heart issues. And that's that mouth-heart axis, or the gum disease, heart disease connection that you may or may not have heard of. That's the most well-known one. And so you hear about like gingivitis and periodontitis, especially periodontitis, which is gum disease, gum inflammation. When you have leaky gums, okay, that can lead to heart disease, specifically because P. gingivalis can go, can hop in the bloodstream and get hung up on heart valves, and the immune system attacks. It shares molecular mimicry with the heart, so the immune system can shoot at the heart like it's shooting at P. gingivalis, and you end up having rheumatic fever or something like that. But there's other pathogens in the mouth that can also lead to systemic disease. One is called Fusobacterium nucleatum, and this one's associated with inflammatory bowel disease and Crohn's and colon cancer as well. So the mouth is not benign. The oral microbiome is important, and just as important as the gut in people in whom the mouth microbiome is unhealthy. So we want to promote, we want to avoid oral pathogens and promote healthy mouth probiotics. So to Linda's question, well, the question behind the question is, well, how do the oral probiotics help us prevent heart disease risk? And that's what we've covered in 2 previous videos specifically, and it all has to do with a chemical messenger called nitric oxide. And nitric oxide is the best vasodilator in our body. And so if we vasodilate, we're actually making our blood vessels wider, which lowers blood pressure and takes stress off the heart. When you have optimal dilation versus constriction, that's a healthy cardiovascular system. Well, the bugs in the mouth, some of the probiotics in the mouth are what are called nitrate reducing bacteria, and nitrate is called NO3. Well, the probiotics in the mouth reduce nitrate to nitrite, which is NO2, and that can be stored in the salivary glands for whenever our body needs it, or it can be swallowed and down in the GI tract in the stomach. The stomach acid helps convert nitrite to nitric oxide, and nitric oxide has functions, like we said, for the heart. It has also functions for the brain and also functions for the immune system. So nitric oxide is very important for systemic health, and the oral nitrate reducing bacteria in the mouth that should be there, their mouth probiotics, help convert nitrates from our diet to nitric oxide. And nitrates from our diet come from things like beets and green leafies. And we don't have nitrate reducing enzymes as humans, so those bacteria fill that role for us. We can convert nitrite to nitric oxide, but to get the nitrite, we need to consume it, and nitrate is the best source for us from our diet, unless we're going to take it supplementally. So beets and green leafies are the best source there. And then the mouthwash part is aseptic mouthwashes kill all the bugs. So it's like a scorched earth policy. They don't just kill pathogens, they kill the probiotics too. So people who take a daily swish of mouthwash, of aseptic mouthwash, are killing their oral microbiome, killing all of them, including the probiotics. So they lose the nitrate reducing bacteria, which decreases their nitric oxide production, which increases risk of hypertension and cognitive decline and immune function. Decreases immune function, decreases cognition, increases hypertension. And it can also lead to increased constipation, because nitric oxide is used for motility as well, or good downward peristalsis to move the stuff through your gut and out. So the aseptic mouthwash you definitely don't want. Linda mentioned she uses biocidin toothpaste. The biocidin won't be as scorched earth policy, Linda, because that's herbal, and herbs aren't as powerful as, say, aseptic mouthwash or medications. And different bugs are more or less sensitive to different herbs, depending on, are they gram positive or gram negative, etc. So you are not necessarily you're not damaging it as much as an aseptic mouthwash, but I don't think it's something that necessarily needs to be used every day either. Mm-hmm. Because it's not necessarily a heat-seeking missile for just the bad guys either.
Should it be used at all? And if so, how often?
Well, I think it should be used when someone has a dysbiotic mouth. And up until recently, we kind of had to guess that through exam. And like if you have tender gums, or if your gums bleed when you floss, or if you have any gingivitis or periodontitis, those kind of findings would be, yes, use it. More recently, there's a lab that does, and in one of the videos I show the lab, but there's a lab where we can do oral microbiome testing, and it shows you, are pathogens overgrown and what have you. So, when I run that test and it's lab high on someone, that's at least a test proof that, hey, this is where the biocidin and antimicrobial oral strategies can be useful or more prudent.
So it sounds like, for the most part, it should be contraindicated as a part of a health routine.
Yeah, I wouldn't make it a daily thing. I'd keep it.
But how about intermittently, or twice a week, or once a week, or?
Yeah, maybe once a week or once every 2 weeks. And maybe use like a silver toothpaste